My guest is Dr. Richard Hart, who is the president of Loma Linda University. Dr. Hart, thanks for joining us.
Good to be with you, Gary.
Can you please give our viewers some sort of an idea of the size and scope of Loma Linda University?
Well, we now actually call it Loma Linda University Health because we're one combined corporation. We have approximately 15,000 employees, about 4,500 students, and roughly 1,000 doctors on our staff. So that's the scope of Loma Linda.
Wow. Now, describe some of the different schools that you have.
There's 8 professional schools in the university. So many people think of us as medicine, nursing, dentistry, that we certainly have. But there's also pharmacy, one of our newer schools, a school of behavioral health, a school of public health, a school of allied health professions, and the school of religion. The religion school is actually the smallest school by their own students, but the largest school because they teach all of our students. Okay. So they teach across the entire campus.
Right. So how would you summarize the mission, the purpose of the institution?
I mean, we take very seriously what we now call mission-focused learning. How do we prepare our graduates to serve the world? And we do that in a number of ways. We actually do a lot of community activities. We recently started a San Bernardino campus, and this is what we call the San Manuel Gateway College, to engage our students with the local community issues, to help them understand cultural and economic issues in a disadvantaged community. And then, of course, we leverage from there to go abroad. We have a program we call SIM, Students for International Mission Service, that now sends about 600 students a year, go someplace every year. About 15% of our student body, and we continue to grow that number. And then we have a number of programs that enable those students to go to serve after they graduate. We have a system set up now with endowments so that any Loma Linda graduate from any school, if they want to serve abroad after graduation, we will make their educational debt payments for them while they serve abroad. So that's opened up the whole world field to not just medical students and dental students, but all of our students, public health, nursing, pharmacy, all the different students to have a chance to serve abroad.
So why is that so important to you as an institution?
Well, to me, this is what Loma Linda needs to do to still be Loma Linda. We often look at this and say, well, what a wonderful thing you do for the World Church. I look at it exactly the other way around. What a wonderful thing the World Church provides us to prepare our students for service. Because it's been shown many, many times that a person that engages in service is truly happy and complete in and of themselves. Right. So that's what we're trying to do, is give our students a sense of it, the skills, the sense of accomplishment to be able to engage in service around the world.
Now, you're not just talking about this theoretically, because I understand that you were one of the very first Adventist volunteers to go overseas to serve. Tell me about that.
Well, that was a long time ago, but actually after my sophomore year at Walla Walla College, I was the first student missionary they sent abroad. At that time, we just did 3 months, raised our own funding, and I went down to the jungles of Peru and worked down there in Iquitos, became a dentist, pulled 100 teeth, and did various things down there in Peru. So that was my first introduction to service abroad.
And how did that affect your outlook on mission?
I was already focused on serving abroad even before then, but that certainly accelerated it. I'm fascinated by cultural understanding and all the issues that come up when you work in different settings. So that's been the story of my life. Many people think I grew up as a missionary kid. I did not. I grew up in northern Idaho. I mean, I was a typical farm boy in northern Idaho, but I was bitten by the idea of working abroad.
Then you later served in Africa?
Yes, we worked actually for the U.S. State Department in the country of Tanzania, helped to develop a national maternal and child health program in the Ministry of Health for the government of Tanzania, and then came back to Loma Linda and have been there ever since.
Wonderful. Now, you described a huge institution to us, mammoth. How do you keep something so big with so many departments? How do you keep it focused on mission?
That's always a challenge, of course, with as many activities as we have going on, but we're very deliberate about that. And we basically have programming, we have actual activities we encourage the students to take part in. It becomes part of their curriculum. One of the points I make at Loma Linda, this isn't co-curricular activities, this is curricular activities. This is how you become a professional. And so we are very deliberate about the kind of program. In my view, you do this by experiential learning. This is not classroom teaching. This is how do I engage with human need in a real way, and that tends to help to influence who I become.
Excellent. Tell us about Adventist Health International and the work that it does.
About 20 years ago now, we recognized that many of our mission hospitals were caught up in increasing competition from others, decreasing professionals wanting to work for them, and so on. So we started AHI, Adventist Health International, to try to work on that. We now have some 40 hospitals that we work with around the world. It's a matter of trying to set up a better system of governance and management, encouraging donors to once again engage with our institutions, encouraging young Adventists and professionals to come and be part of our institutions. All those things we've gradually lost through the years. So we've tried to carefully develop a management and governance system that still leaves ownership with the local church, but brings in the kind of expertise and management models that can help to reassure donors and professionals that it's worthwhile to engage with the church and become employees of the church.
Okay, wonderful. Now, Dr. Hart, one of the things that's very important to us in Global Mission is the great growing urban areas of the world. And you're a public health professional. What does the church have to offer to the cities?
One of the things, and particularly in Africa, and less so in Asia, most of our hospitals are rural hospitals. We have very little in the cities. And so one of the objectives we have right now is establish medical centers in the cities. Not big fancy hospitals, but multi-specialty clinics, places that our young Adventist health professionals come to work, support themselves, but service and witness to that city. So we're now in the process of building one of those in Lusaka, Zambia, a place we call Chilala, one in Lilongwe, Malawi, another one in Blantyre, Malawi, and looking at other places that we can actually establish city centers of influence. Fantastic. We'd like to go into some of the other countries. I mean, this is the answer to, frankly, the broad expanse of Northern Africa and the Middle East, is how do we establish things like that? So we actually have graduates who are saying, tell me how and when. Wonderful. I just recently had a young dental couple come to me. Both of them third-year dental students, Korean-American background, say our passion is we're going to start a dental clinic in Phnom Penh, Cambodia, where we have very little as a church. That says, great, we'll work with you to get that set up.
Fantastic. Dr. Hart, thanks for sharing with us, and thank you for what you're doing through Loma Linda.
Thank you.
And viewers at home, please pray for Dr. Hart and Loma Linda University Health. What a wonderful ministry, what a blessing they are to helping communities all around the world finding hope not just in life now, but also hope for the future.